Hey guys, so today we're going to be talking about neural tube defects, and I'm going to cover the Spina Bifida classes as well as Anencephaly. Okay, so let's talk about the neural tube for a second just to review some embryology. So we have the trilaminar disc and the notochord inside your mesodermal cell layer, and that's going to go ahead and stimulate the ectoderm to form the neural plate. Okay, so the neural plate is then going to form two neural folds and a neural groove, and these folds will come together to eventually form your neural tube. Okay, so that was a very quick review, and it was just to help us get to the neural tube stage. So here's our neural tube in 3D on the left, and the neural tube forms your central nervous system. So cranially, we have the brain, which comes out of there, and caudally, we're going to get the spinal cord. Another important function of your neural tube is that it's going to help in the development of the bony structures around your CNS. So the vertebral column, as well as your skull, are also made with the help of your neural tube. So I know a lot of you think generally when you think of bone formation or you think of the vertebral column, you think paraxial mesoderm forms your somites, and then your somites forms your sclerotome, which then forms your vertebrae, and that's true. But we also have the formation assisted by the neural tube. And if the neural tube doesn't develop properly, you'll see this vertebral column doesn't develop properly either. So a common defect is called spina bifida. This is a neural tube defect where the vertebral arches do not form properly. So the most common and least worrisome is called spina bifida occulta. And occulta means hidden, and this is the smallest opening or smallest defect. Nothing leaks out of your vertebral column, so your spinal cord, and your meninges are all still in there, and this is generally asymptomatic. The only thing you'll see with occulta sometimes is a tuft of hair or a skin dimple above the region with the defect. So easiest one to have is occulta, and that's also the most common, fortunately. Now there's three types of cystica, spina bifida cystica, and this is meningocele, meningomyelocele, and myeloschisis. Okay, so cystica, what do you think of cystica? You think of cyst, so there's going to be a bump, and depending on which type of spina bifida you have, this cyst contains different things. Okay, so in meningocele, you're going to have exactly what this sounds like, meninges. So you're going to get the dura mater, the arachnoid mater inside of this cyst, and you're going to get CSF, okay? And this opening, so this vertebral arch, is generally even less developed than you would see in occulta, so more can leak out, okay? This is the least common form. Then we have meningiomyelocele. So not only do we have the meninges, we have myelo. Or when you think myelo, you think myelin, you think neural structure, so you're going to get the spinal cord in there. So this is the most severe type, and it's a big problem because if the spinal cord is outside your vertebral column, it's susceptible to damage, susceptible to infection, not a good thing to have. Then we have myeloschisis. So this is actually even worse than meningomyelocele because it's the same thing, except now we don't even have skin or meninges covering our spinal cord. So those haven't developed at all. And we have our spinal cord open to the air, which is the easiest way to get an infection or damage. So this is open spinal cord myeloschisis. So next, let's talk about anencephaly. So this is when the cranial neural pore fails to close. So this happens around day 25, and we're going to get lack of formation of the most apical portion of our neural tube, which is called the telencephalon. So if your telencephalon does not form properly, you don't get formation of your cerebral hemispheres as well as your thalamus, but you'll still get a midbrain, pons, medulla, cerebellum, except the majority of the brain doesn't form. And as we talked about before, the neural tube also helps with bone development, so a lot of these kids that are born with anencephaly also don't have skulls, so sometimes the brain is just open to the outside. Okay, and a common preemptive treatment for trying to not get neural tube defects is giving the mother folate, and this is also known as vitamin B9. And so preemptive folate is going to help with normal fetal development and to help to avoid neural tube defects. Alright, I hope this video helped, and I'll see you in the next one.